Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. ECG leads. So first, let's look at what are the leads. So the limb leads, what the function is, it measures the electrical activity in the frontal plane. So it measures the electrical activity in the frontal plane. And then we also have the chest leads. So this chest leads measures the electrical activity in the horizontal plane. Now let's look at each of the leads. So first is the limb lead 1. So in terms of limb lead 1, the location is positive. So if we look at the location, it is positive, that is LA. LA stands for the left arm, and then negative at the RA, that is the right arm. So the augmented limb leads, ALL, augmented limb leads, will be the AVF, and the location is the LF positive. So chest leads V1. So how is the location? The location is 4th intercostal space. It is located at the 4th intercostal space and just to the right of the sternum, and it is to the right of the sternum. Next we move on to the lead 2. So limb lead 2 is positive at LL and negative at RA. Then the augmented limb leads, it includes the AVL. Augmented limb leads, it includes the AVL. And looking at location, it is LA positive. So the V2 lead, it is located in the, again, the 4th intercostal space and just to the left of sternum. It is to the left, and where it is present to the left of the sternum. Next is we look at the variety 3. So limb lead 3, the location is positive, that is the LL, and negative, that is the LA. And where is the augmented limb leads? Augmented limb leads is nothing but the AVR. Now let's look at the location. Location is RA positive. So location is nothing but the RA positive. And now let's look at all the leads. So V3 is midway between the V2 and V4. So it is between the V2 and V4. Next we move on to the V4. V4 is mid-clavicular line, 5th intercostal space. So V4 is the mid-clavicular line. And it is in the 5th intercostal. It is in the 5th IC, that is the intercostal. Next we move on to the V5. V5 is the anterior axillary line, and it is at the same level at S4. So it is the same level as the V4. Then we move on to the V6. So here V6 is in the mid axillary line, the same level as the V4 and V5. So the mid axillary line, and it is in the same level as that of V4 and V5. To learn and grow daily like this, please do subscribe.